I think the thing that makes this practice special is we're able to work in an environment where the fundamental goal is getting the patient from being sick to being better without an intervening agenda. Our hospital allows us to take care of people in the way we feel like is best for them, that we recognize as special and unique. And we're thankful for it. In terms of the capacities we have, I think that they are simply unmatched as a function of a collective experience that dates back more than a decade, and that is extraordinarily unique. And for the patient, it's extraordinarily important. I would argue that the team that you're working with is every bit as important, and perhaps even more important than the surgeon. If the team isn't a good team, it can't salvage a surgeon, and vice versa. You need them both to be at the top of their game, and we have that here. So since we started this enterprise, the same crew of people has been there, and so the experience of the patient in having this procedure is remarkably smooth, completely uneventful, drama-free enterprise, which is a function of a bunch of people who are intimately familiar with what they need to do, how it needs to be done, and get the job done well. Deep brain stimulation is, unfortunately, I think, a somewhat poorly named procedure because the name alone is horrifying. The majority of people that we see clearly are people with Parkinson's disease. The second larger people we see are people with essential tremor, which is a very common problem. The third group of people who have what's called dystonia, which is a more complicated movement disorder, and there are a smattering of other indications. The idea with deep brain stimulation is to alter the circuitry of the brain in such a way as to diminish the symptoms of a major movement disorder. So if you have primarily tremor, try to reduce that degree of tremor. If you have Parkinson's disease, try to help reduce the symptoms of that disease and help life go better. The actual procedure of deep brain stimulation is simply a matter of placing these thin probes into specific parts of the brain, connecting those probes to a pulse generator or pacemaker-like device, and utilizing that stimulating technology to help alter the brain circuitry in such a way that it helps reduce the symptoms that are disabling to an individual. The risk and benefits of surgery are a discussion that you need to have about any surgical procedure, and there's always risk. Ignoring risk, glossing over risk, minimizing risk, in my view, does not serve the patient or the surgeon well. And with deep brain stimulation, the risks gratefully are small, they are low, but they're not zero. And of all the risks that we encounter, certainly the gravest risk is that of hemorrhage. It is a rare thing. It is not entirely preventable, although in large measure we've reduced that risk to, I think, absolutely as low as it can be. But that remains a immutable risk of such a procedure. And one of the things I think that sets our program apart is from the very inception of this program, we have really strived to minimize risk. And minimizing risk recognizes that people who have Parkinson's disease are people who, if we can stress them as little as possible, we think that is entirely in their best interest. So typically, we keep them on their Parkinson's medications through the time of surgery. We don't stop their Parkinson's medications. Another way we try to reduce the risks is try to keep the procedure as a self-contained event. So in our circumstance, we put the deep brain stimulating leads in position, and at that same sitting, we connect them to the pulse generator pack. It's done all at one time. We feel like that's a very, very appropriate way to do this. We're very fortunate that our hospital system allows us to do it that way. We think from the patient standpoint, that is a much preferred option than to putting the leads in place, going home, coming back, reopening a healed incision over delicate leads, and putting the pulse generator in place as a second event. And at the end of the day, I think the way anybody from the outside world assesses things is how much good did you do for people. Okay, it's wonderful that the surgery was just really exciting and fun and interesting and challenging. Did you help anybody? And I can say unequivocally that of all the things I've done in my career in neurosurgery, the enterprise which has absolutely helped more people than anything else I've done by a wide margin is deep brain stimulation. And that does not imply uniform success, because that's not the way it works for anything in neurosurgery. But on balance, deep brain stimulation has provided more help for people, and reliably so, than anything else I do, hands down. There's no question about it.